Is your erection different as you get older? Perhaps you've noticed a change. Maybe it takes longer to become fully aroused, or your erection isn't quite as firm as it used to be. Maybe you're concerned about whether this is normal or if something is wrong. Today we're going to talk about how erections change as men mature and what's actually happening inside your body when these changes occur. The penis of older men is much more sensitive to factors like blood flow, hormone levels, and overall health than many realize. These changes don't mean your sex life is over, far from it. But understanding what's happening physiologically can help you adapt and continue enjoying a fulfilling, intimate life. Let's explore why these changes happen, what you can expect, and most importantly, what you can do to maintain healthy sexual function for years to come. As you enter your mature years, your body undergoes many changes, and your sexual response is no exception. The penis itself experiences several physical changes that directly affect how erections work. First, the smooth muscle tissue inside the penis gradually loses some of its elasticity. This tissue needs to relax to allow blood to flow in and create an erection. When it becomes less flexible, blood doesn't fill the chambers as quickly or completely as before. Blood flow itself also changes with age. The tiny blood vessels that carry blood to the penis may narrow or develop small blockages over time. This is often linked to the same processes that affect heart health, like high blood pressure, high cholesterol, or diabetes. When less blood reaches the penis, erections can take longer to form and may not be as firm. Hormone levels play a big role too. Testosterone naturally decreases as men age. This hormone helps trigger sexual arousal and supports the physical processes needed for an erection. When levels drop, you might notice it takes more direct stimulation to become aroused, and your overall interest in sex might change. The nerves that send signals between your brain and penis can also become less sensitive over time. These nerves need to detect touch and send messages that trigger the chain of events leading to an erection. As nerve function slowly changes, these signals may become weaker or take longer to transmit, affecting how quickly you respond to sexual stimulation. Your overall health has a major impact on erections. Conditions that become more common with age, like heart disease, high blood pressure, diabetes, and obesity, can all affect sexual function. Even some medications used to treat these conditions might have side effects that impact erections. It's important to know that these changes happen gradually and vary greatly from person to person. Some men notice very little difference, while others experience more significant changes. What you're experiencing isn't a sign of weakness or failure. It's simply your body adjusting to natural changes. Many men worry that these changes mean the end of their sex life, but that's not true. Your body is adapting, and you can adapt too. Sexual pleasure doesn't depend only on the hardness of an erection. Many men find that as they get older, they gain a deeper understanding of what brings them and their partners satisfaction. Have you noticed that it takes longer to become aroused than it used to? This is completely normal. The time between thinking about sex and having a physical response often increases. What used to take seconds might now take minutes, but the pleasure can still be just as satisfying. Sometimes even more so, as many men find they gain better control over their sexual response. Recent studies on male sexual health have shown that circulation plays a much bigger role in erection quality than previously thought. The penis relies on a healthy flow of blood to function properly. When researchers looked at men with erection changes, they found that over 70% had some form of reduced blood flow. This happens because the small blood vessels in the penis can develop tiny buildups of plaque over time, the same process that affects heart health. The good news is that these changes respond well to the same habits that help heart health. Men who walk just 30 minutes daily show measurable improvements in erection quality after only a few weeks. This happens because exercise helps keep blood vessels flexible and improves overall circulation. Stress is another major factor that many men don't connect to erection changes. When you feel stressed, your body releases hormones like cortisol that actually restrict blood flow to areas not needed for immediate survival. Since erections aren't essential for survival, blood gets directed away from the penis during stressful periods. Learning simple stress management techniques can have surprising effects on sexual health. Sleep quality shows a direct link to morning erections, which are a good sign of overall sexual health. During deep sleep, your body naturally increases blood flow to the penis, which helps keep the tissue healthy. Men who get less than 6 hours of sleep regularly show a much higher rate of erection problems than those who get 7 to 8 hours. Early warning signs that your circulation might be affecting your erections include taking longer to become fully hard, losing firmness during sex, and fewer morning erections. These signs often show up years before more serious erection problems develop, giving you time to make changes. The penis itself actually changes slightly in size as you age. This isn't because the penis is shrinking, but because the tiny chambers that fill with blood may lose some elasticity, making them unable to expand as fully. Additionally, a slight increase in fatty tissue in the lower abdomen can make the penis appear shorter, even though its actual size remains the same. Surprisingly, what you eat directly affects how well your penis works. Foods high in nitrates, like beets, spinach, and celery, help your body produce nitric oxide, a compound that helps blood vessels open wider. Men who eat these foods regularly report better erection quality. In contrast, highly processed foods can damage the delicate lining of blood vessels, making them less responsive. What do you think about all this? Let me know in the comments below. Did you know that the muscles at the base of your penis play a key role in erection strength? These pelvic floor muscles help trap blood inside the penis during an erection. When these muscles weaken with age, blood may leak back out, causing the erection to soften. Simple exercises to strengthen these muscles can make a big difference in how firm and lasting your erections are. Hormones like testosterone do decrease with age, but this drop is much more gradual than many believe. Most men maintain enough testosterone for sexual function well into their later years. However, even small decreases can affect how quickly you respond to sexual stimulation and how often you feel the urge for sex. There's a common myth that sexual function must naturally end as you get older, but this simply isn't true. The changes in erections don't mean the end of sexual pleasure. They just mean adjustments need to be made. Think of it like driving a car that's been on the road for many years. It might need more warm-up time and careful handling, but it can still take you where you want to go. One of the biggest benefits of these changes is that many men find they gain better control over when they reach climax. The same factors that make erections take longer to develop often extend the time before ejaculation. This can lead to longer-lasting sexual encounters that many couples report as more satisfying than the quicker experiences of youth. However, there are things to be careful about too. Medications for erection problems can work well, but they aren't right for everyone. Men with certain heart conditions or who take medications called nitrates should avoid these pills, as the combination can cause dangerous drops in blood pressure. Always talk with a healthcare provider before trying any medication for erection problems. Some men try to fix erection changes by drastically increasing their testosterone through supplements or treatments. This approach needs caution. Too much testosterone can increase risks for prostate problems and may not actually solve erection issues if the main cause is poor circulation or nerve sensitivity. Over time, men who don't stay sexually active may notice that erections become even more difficult to achieve. This happens because the penis, like any body part, needs regular blood flow to stay healthy. Going long periods without erections can actually make the tissue less elastic. Regular sexual activity, with or without a partner, helps keep blood flowing to the penis and maintains better function. What about exercise? Too little is bad for erections, but extremely hard exercise like long-distance cycling can sometimes cause temporary problems. This happens because bicycle seats can put pressure on the nerves and blood vessels that supply the penis. Using specially designed seats can help prevent this issue. Many men wonder if surgery might be the answer for erection changes. While there are surgical options, they're usually only needed in special cases where other approaches haven't helped. Most men can maintain satisfying sexual function without surgical treatments. Have you heard that certain foods can work like natural Viagra? There's some truth to this. Foods rich in compounds called flavonoids, like dark chocolate, berries, and red wine, do help improve blood vessel function. However, they work gradually over time rather than providing an immediate boost. The effect comes from eating these foods regularly, not just before sexual activity. Stress and anxiety create a harmful cycle for erections. When you worry about your performance, your body releases stress hormones that make erections more difficult. This leads to more worry, which causes more stress hormones, and the cycle continues. Learning to focus on pleasure rather than performance can break this cycle. Many men find that removing the pressure to have a perfect erection actually helps their erections improve. Alcohol affects erections differently as you age, too. While one drink might help you relax, even moderate amounts can interfere with erection quality more than they did when you were younger. The penis becomes more sensitive to alcohol's effects on blood flow, making it harder to achieve and maintain firmness. What steps can you take today to improve your erection health? Start with small daily habits that make a big difference. A morning walk for just 20 minutes gets blood flowing throughout your body, including to your penis. Adding foods like leafy greens, beets, watermelon, and fish to your meals helps support the blood vessel function needed for good erections. If you're taking medications for other health conditions, talk with your doctor about possible effects on erections. Sometimes a simple adjustment in dosage or switching to a different medication can solve the problem without affecting treatment for your other condition. Sleep quality matters tremendously. Creating a cool, dark sleeping environment and avoiding screens for an hour before bed can help improve deep sleep, which is when your body does much of its repair work, including in the penis tissue. Pelvic floor exercises can strengthen the muscles that help maintain erections. These simple exercises involve tightening the muscles you would use to stop urination midstream, holding for a few seconds, then releasing. Doing 3 sets of 10 contractions daily can show results within weeks. If erection changes are causing significant distress or affecting your relationship, don't hesitate to seek help from a healthcare provider who specializes in sexual health. Many effective treatments exist beyond just pills, including lifestyle changes, therapy, and other medical approaches. Remember that communication with your partner becomes even more important as your body changes. Many couples discover new ways of giving and receiving pleasure that don't rely solely on erections, but still create deep satisfaction and intimacy. By making these changes, you can expect gradual improvements in erection quality, staying power, and sexual satisfaction. Many men report feeling more confident and relaxed about their sexual performance after implementing even a few of these suggestions. The penis of older men is much more responsive to good health habits than many realize, giving you significant control over your sexual well-being for years to come. Thanks for watching. If you found this valuable, like the video so you can find it again when you need it.